So now we're going to finish up with the eye chapter, and we're going to start off with glaucoma. Now, normally the aqueous humor is formed by the ciliary body, flows into the anterior chamber, and leaves the eye at the angle where the cornea and the iris meet. Okay, so that's this angle right here. In chronic, that's this side, chronic open angle glaucoma, you have a degeneration of the trabecular meshwork filters that lead to aqueous backup and chronically increased eye pressure. With prolonged eye pressure, the ganglion nerves, which form the optic nerve, in the retina atrophy. Okay, now this trabecular meshwork, it's a series of drainage channels. Now, on the right-hand side, you have acute closed angle glaucoma. The iris is pushed or pulled up against the trabecular meshwork at the angle of the anterior chamber of the eye. So you see that right here? So that's the angle that's closed, okay? When this happens, the aqueous humor that normally flows out of the eye is blocked. It cannot drain out, thereby increasing intraocular pressure. So, in glaucoma, generally, there's an increased intraocular pressure that results in damage to the retina and optic nerve. It's increased because of the inability of aqueous humor to drain from the eye and enter the bloodstream. So there's excessive pressure in the anterior chamber of the eye. In chronic open angle, the aqueous humor, the reabsorption is impaired, and in acute closed angle, the opening of the drainage system can close completely. So we go from normal vision to early glaucoma, advanced, and extreme glaucoma. So you lose peripheral vision. Now, these are symptoms of acute closed angle glaucoma. So you have your extreme headache, distorted vision, eye reddening, severe eye pain, nausea and vomiting, and halos around the lights. Macular degeneration. This is a progressive damage to the macula of the retina. It causes a severe loss of central vision. Now, there are two types. There's wet and dry. Let's talk about the dry first. So in dry macular degeneration, you have Bruch's membrane, which is a deep collagen membrane, lies between the retina and choroid layers of the eye. With increasing age, Bruch's membrane loses its ability to control diffusion of serum into the retina. As a result, drusen, which is a fluid precipitate, form beneath the retina. Now, in wet macular degeneration, you also see the presence and leakage of abnormal blood vessels, and you can see this under fluorescein angiography. So, in macular degeneration, so you see the print may appear distorted, okay, and you lose that central vision. Diabetic retinopathy. Vascular changes in the retina cause capillary aneurysms, bleeding, and scarring. Retinal scarring decreases visual acuity and may eventually lead to blindness. This is a complication of diabetes that results from damage to the blood vessels of the retina. 45% of people with diabetes, either 1 or 2, in the United States have some degree of diabetic retinopathy. With hyperglycemia, the natural lens of the eye may swell, which causes blurred vision. Eventually, this increased blood sugar can damage retinal capillaries. Okay. And then you have something called cotton wool spots. Okay. That's like this little, see these like lighter areas in here? These are fluffy white patches on the retina due to retinal ischemia. And then, so this is what a person sees. So this is the normal retina, okay? And this is a person with diabetic retinopathy. You see these big spots all over. We have a retinal detachment. So the retina separates from the choroid, okay? Signs and symptoms, you have floaters, flashes of light, dark shadow that extends from the periphery inward. That's that dark shadow. Okay. Now these floaters are black spots, usually composed of vitreous clumps that detach from the retina. Also, after you get over 40, you'll start seeing this. And I've had these. I don't have a retinal detachment though, it's just old age. But you can see these little black spots. All of a sudden, it's like a little fish swimming across. And then you just blink and it goes away. Uveitis is an inflammation of the uveal tract, which includes the iris, the ciliary body, and the choroid. And the last one we're going to talk about is exophthalmos. This is an abnormal protrusion of the eyeballs. People with hyperthyroidism, such as Graves' disease, will get this or can get this. And that's it for today.